But for mental health, we need to sleep. For our kids' mental health, they need to sleep. It's called the silent killer. One lady said, my son, he can't sleep. So I said, how old is he? 11. What time does he go to bed? Oh yeah, we put him to bed at 8:30 at night. So a lot of our kids are getting depression. It's alarming the amount that are getting depression, and sometimes it's lack of sleep and too much time on technology. So there must be rules in the home regarding technology.
Nights are supposed to be calm, peaceful, a time for rest and recovery. Yet for many seniors, the hours of darkness bring an unseen danger, a silent killer that strikes quietly, often leaving no warning until it is too late. You may think that strokes or heart problems announce themselves loudly, with obvious pain or distress, but in reality, the early signs, especially at night, are subtle and incredibly easy to miss. Families wake up to tragedy, not realizing that the warning signs were there all along. This is the harsh truth. Undiagnosed heart failure and nocturnal strokes often creep into lives silently, catching both seniors and their loved ones off guard. The focus of this video is to uncover 5 sneaky nocturnal stroke symptoms that most people fail to notice. And these are signs that may appear while your loved one sleeps or during the quiet hours of the night, and can indicate a serious, life-threatening condition. Understanding these warning signs can make the difference between immediate medical attention and irreversible damage. Every second counts when it comes to strokes, and the more informed you are, the higher the chances of preventing catastrophic outcomes. Before we dive in, it's important to remember that the content you are about to hear is for educational purposes only. With that in mind, let's uncover the hidden dangers lurking in the night that too many seniors face silently, and explore the 5 sneaky symptoms that no one should ignore.
As a special thank you for joining us today, we're giving away 100 free copies of my best-selling book to subscribers. So, if you haven't already, make sure to hit that subscribe button and leave a comment about why you want to win my best-selling book.
Understanding undiagnosed heart failure in seniors. Heart failure is often misunderstood. Many assume that it always comes with dramatic, obvious symptoms like intense chest pain or sudden collapse. The truth, especially in seniors, is far subtler. Undiagnosed heart failure develops gradually, sometimes over years, and the early signs can be dismissed as normal aging or fatigue. The heart's ability to pump blood efficiently declines over time, and fluid starts to build up in the lungs, legs, and other parts of the body. At night, when seniors lie down, this fluid can shift, leading to sudden breathlessness, disturbed sleep, or even nighttime coughing fits that seem harmless but may actually indicate severe underlying issues. What makes undiagnosed heart failure particularly dangerous is its connection to strokes. When the heart cannot pump efficiently, blood flow can become turbulent or sluggish. This increases the likelihood of clot formation, which in turn raises the risk of a stroke, often at night when the body is at rest and symptoms can go unnoticed. Because these changes develop slowly, both seniors and their families may ignore or misinterpret them. A simple nighttime cough, an unusual shortness of breath, or persistent fatigue can all be early warning signs, yet they rarely trigger immediate concern until a crisis occurs. Understanding the link between undiagnosed heart failure and nocturnal strokes is crucial. Many seniors experience these silent warning signs without realizing the risk, and families often attribute them to old age. By paying attention to small changes, slight weakness, confusion, or unusual discomfort at night, caregivers can detect early problems and intervene before they escalate into life-threatening events. The danger of nocturnal stroke. Strokes are frightening enough during the day when symptoms are visible and immediate help can be summoned. At night, however, strokes present a unique danger. Nocturnal strokes occur during sleep or the quiet hours of the night, and they are frequently unnoticed until morning. In some cases, seniors wake up with partial paralysis, slurred speech or blurred vision, never realising that the stroke had already occurred hours earlier. This delay in detection dramatically reduces the effectiveness of emergency interventions and increases the risk of permanent damage. One of the reasons nocturnal strokes are so dangerous is that the human body behaves differently during sleep. Blood pressure fluctuates, heart rate slows, and oxygen levels can decrease slightly. These natural changes can exacerbate underlying cardiovascular issues, particularly in seniors with undiagnosed heart failure or other heart conditions. The subtle signs of a stroke, mild numbness, slight facial drooping, or momentary confusion can easily go unnoticed when the individual is asleep or the household is quiet. Furthermore, nocturnal strokes often leave less dramatic but equally important symptoms, which can be dismissed as fatigue, poor sleep, or even normal aging. The challenge is not just in the detection, but in the recognition. Families and caregivers must learn to spot the hidden signals, understand their urgency, and act quickly. The 5 sneaky nocturnal stroke symptoms we will explore next are those that frequently go overlooked, yet awareness of them can save lives. Symptom 1, sudden nighttime weakness or numbness. Imagine a senior waking in the middle of the night to reach for a glass of water or turn over in bed, only to find that their arm or leg feels unusually heavy or numb. This sudden weakness is one of the earliest and most deceptive signs of a nocturnal stroke. Unlike dramatic daytime symptoms, this weakness can be mild, intermittent, or easily dismissed as tiredness or muscle strain. A foot may drag slightly when walking to the bathroom, or an arm may feel limp for a few moments before the sensation fades. This symptom occurs because the stroke interrupts blood flow to parts of the brain that control muscle movement. The affected individual may not recognise the danger, especially if the numbness disappears as quickly as it arrived. Families too may overlook the subtle difference, attributing it to ageing or fatigue. The real danger lies in ignoring these fleeting moments. Even temporary weakness is a warning that the brain is under stress, and immediate medical evaluation is necessary to prevent permanent impairment. Symptom 2, nighttime confusion or sudden memory loss. One of the most insidious signs of a nocturnal stroke is sudden confusion or memory lapses during the night. Picture a senior who wakes up to use the bathroom or check on something in the middle of the night, only to find themselves disoriented, unsure of where they are, or unable to remember simple facts about their surroundings. These episodes may last just a few minutes, making them incredibly easy to overlook. Yet even brief confusion can indicate that the brain is experiencing oxygen deprivation or damage from a stroke. The danger lies in the subtlety. Family members may assume that this disorientation is simply a result of poor sleep, aging, or medication side effects. A senior might mutter the wrong words, get lost in their own bedroom, or forget basic routines, and everyone dismisses it as fatigue. However, when these incidents occur repeatedly or suddenly at night, they are often precursors to serious neurological events. Early recognition can be life-saving. Nighttime confusion is particularly linked to strokes in areas of the brain responsible for memory, speech, and spatial awareness. Seniors with undiagnosed heart failure are at even higher risk because fluctuating blood flow and reduced cardiac output during sleep can impair brain function. Families should pay close attention to any unusual nighttime behaviour and keep track of patterns, no matter how small. Recording these incidents in a journal can help doctors identify the underlying cause before a full-blown stroke occurs. Symptom 3, sudden severe headaches at night. A sudden intense headache in the middle of the night is another warning sign that is often underestimated. Unlike ordinary tension headaches, these headaches appear abruptly, sometimes waking a senior from deep sleep. They may describe it as the worst pain they've ever experienced, or a pressure that feels concentrated on one side of the head. Such headaches can signal an interruption of blood flow to the brain, a hallmark of a stroke. What makes this symptom particularly dangerous is its unpredictability and the tendency for it to subside without intervention. A senior might take a painkiller and fall back asleep, and both they and their caregivers may assume it was just a migraine or tension headache. In reality, the stroke may have already begun. These headaches can also be accompanied by other subtle signs such as nausea, light sensitivity, or brief vision changes, which are often dismissed in the quiet of night. The connection between heart failure and these headaches is also critical. Fluid retention, high blood pressure, and irregular heart rhythms increase the risk of vascular events. When blood pressure spikes at night or when the heart struggles to pump efficiently, the sudden strain on brain arteries can trigger intense headaches. Recognizing this symptom and seeking immediate medical evaluation can prevent more serious neurological damage and long-term consequences. Symptom 4. Difficulty speaking or slurred speech during the night. Another sneaky nocturnal stroke symptom is difficulty speaking, which can appear suddenly while a senior is asleep or waking. A caregiver may notice that the senior's words are slurred, sentences are incomplete, or speech is unusually slow. Sometimes the affected individual is aware that something is wrong but cannot articulate it clearly, which can be both terrifying and confusing. Slurred speech occurs because a stroke may impact the brain areas responsible for language and communication. At night, when the body is at rest, these neurological disruptions can manifest subtly at first. A senior might attempt to call for water, alert someone, or respond to a question, but the words come out jumbled or incoherent. Families often mistake this for fatigue, medication effects, or just old age, not realizing that immediate medical intervention is necessary. This symptom is particularly important because it is highly time sensitive. Quick recognition and emergency response can dramatically reduce the severity of stroke outcomes. Moreover, seniors with undiagnosed heart failure are at higher risk because irregular heart rhythms or poor blood circulation can trigger these neurological disruptions. Caregivers should take any sudden changes in speech seriously, even if they appear mild or brief, and seek medical attention immediately. Symptom 5, sudden vision, changes or loss in one eye. Vision changes or sudden loss of sight in one eye during the night is a symptom that often goes completely unnoticed until it becomes severe. A senior may wake up with blurred vision, double vision, dark spots, or temporary blindness in one eye. These disturbances occur because a stroke can disrupt the blood supply to the parts of the brain responsible for vision. The subtlety of this symptom makes it extremely dangerous. Temporary visual disturbances may resolve within minutes, leading both seniors and caregivers to dismiss them as fatigue, eye strain, or poor lighting. Yet even brief episodes are critical warning signs of underlying vascular problems and require immediate attention. Vision problems during the night are especially concerning because seniors often do not have anyone observing them while they sleep. By the time a pattern emerges, significant brain damage may have occurred. In seniors with undiagnosed heart failure, blood clots or irregular circulation increase the likelihood of these episodes, making vigilance essential. Families should be aware of complaints like seeing flashes of light, sudden blurring or shadows in vision, and treat them as urgent signals to seek medical evaluation. Detecting these symptoms early. Awareness is the first step toward protection. Detecting nocturnal stroke symptoms early requires careful observation and attentiveness to subtle changes. Families and caregivers should maintain a nighttime routine of monitoring, noting anything unusual in movement, speech, memory, or vision. Even minor irregularities can provide critical clues about the health of a senior. Keeping a journal of nighttime events can be invaluable. Recording episodes of weakness, confusion, headaches, slurred speech or vision changes allows doctors to identify patterns and potential risks. Seniors themselves should be encouraged to speak up about any unusual sensations, even if they appear temporary or minor. Early recognition and medical consultation can prevent complications and drastically improve recovery outcomes. Preventive measures and lifestyle adjustment. Prevention is always better than cure, especially when it comes to seniors at risk of heart failure and nocturnal strokes. While medical intervention is essential for those already diagnosed or exhibiting symptoms, lifestyle adjustments can significantly reduce the likelihood of a stroke occurring during the night. Maintaining a healthy heart and stable blood flow is critical, and even small, consistent changes can have a profound impact. One of the most important aspects of prevention is managing cardiovascular health. Regular checkups with a healthcare provider allow for monitoring of blood pressure, cholesterol, and heart function. For seniors with undiagnosed heart failure, early detection through routine tests can prevent fluid buildup and reduce the stress on the heart at night. These checkups can also identify irregular heart rhythms, which are a major contributor to clot formation and subsequent strokes. Dietary adjustments play a crucial role as well. A diet rich in fruits, vegetables, lean proteins, and whole grains supports heart health and reduces the risk of clotting and high blood pressure. Limiting sodium intake is particularly important for seniors with fluid retention issues, as excess salt can exacerbate swelling and increase nighttime blood pressure spikes. Hydration must be balanced, not too little to cause dehydration, but not so much as to overload the heart or kidneys, which can worsen heart failure symptoms during the night. Regular physical activity is another key component. Even gentle exercises like walking, stretching, or chair exercises can improve circulation, strengthen the heart, and enhance overall vascular health. For seniors with mobility challenges, light resistance training or guided physiotherapy sessions can provide similar benefits. Exercise also helps maintain mental clarity, reducing nighttime confusion or cognitive disturbances, which may otherwise be mistaken for stroke symptoms. Sleep quality and positioning are also critical factors. Seniors should aim for consistent sleep schedules, avoiding excessive daytime napping that can disrupt nighttime circulation. Elevating the head slightly while sleeping can help reduce fluid accumulation in the lungs, alleviating shortness of breath and minimising stress on the heart. Caregivers should also ensure that the sleeping environment is safe and well lit, reducing the risk of falls or injuries if a senior experiences sudden weakness or confusion during the night. Monitoring medications is another vital preventive strategy. Many seniors take multiple prescriptions, some of which can affect blood pressure, heart rhythm, or sleep patterns. It's crucial to review medications with a healthcare provider to ensure they do not inadvertently increase the risk of nocturnal stroke. Adjustments in timing or dosage can make a significant difference in protecting seniors during the night. Ultimately, prevention is about creating a comprehensive approach that combines medical supervision, healthy lifestyle choices, and vigilant observation. When families understand the risks and take proactive steps, they can dramatically reduce the chances of a nocturnal stroke striking silently in the night. How to act quickly in emergencies. Even with preventive measures, emergencies can still occur. Knowing how to respond immediately when a nocturnal stroke is suspected can save lives and reduce long-term damage. Time is critical during a stroke. The earlier a senior receives medical attention, the better their chances of recovery. Recognising the warning signs we've discussed is the first step, but acting decisively is equally important. If a senior exhibits any of the sneaky nocturnal stroke symptoms, sudden weakness, confusion, severe headache, slurred speech or vision changes, families should call emergency services immediately. Do not wait for symptoms to improve or dismiss them as minor. In strokes, every second counts, and delays can result in permanent brain damage. While waiting for help, try to keep the senior calm and comfortable and ensure they are lying in a safe position to prevent falls or injury. Recording the exact time the symptoms began can be crucial for medical professionals. Many treatments, such as clot-busting medications, have strict time windows for effectiveness. Providing accurate information about symptom onset allows doctors to make timely and appropriate decisions, increasing the chances of a successful outcome. Caregivers should also be prepared with basic information about the senior's medical history, medications, and known heart conditions. This information can expedite treatment and help healthcare providers understand potential complications. Being prepared in advance, having emergency numbers visible, knowing the fastest route to the hospital, and having transportation ready can make a life-saving difference. After the emergency, follow-up care is essential. Doctors may recommend rehabilitation, medication adjustments, or lifestyle changes to prevent future strokes. Families should ensure consistent monitoring and adherence to medical advice, fostering an environment that supports recovery and long-term heart health. Understanding these symptoms is only half the battle. Action is what saves lives. Families must adopt a proactive mindset, treating even the smallest warning signs with seriousness. Recording nighttime symptoms, noting unusual behaviours, and maintaining consistent check-ins are all simple yet effective measures. A small habit of monitoring sleep behaviour, documenting headaches, or observing movement patterns can provide critical data for healthcare professionals. Seniors themselves should be encouraged to speak up, even about minor discomforts or transient episodes. Educating them about these 5 sneaky nocturnal stroke symptoms empowers them to recognise danger early. Confidence in reporting symptoms reduces delays in seeking help, which can be the difference between full recovery and lasting impairment. Reinforcing the urgency and importance of vigilance. It is vital to internalise a simple but powerful principle. Nighttime strokes are not always obvious, but they are never harmless. The quiet, subtle and fleeting nature of these symptoms is exactly what makes them dangerous. When a senior exhibits sudden weakness, confusion, severe headaches, speech issues or vision changes during the night, these events must be treated as urgent. The consequences of ignoring them are severe. Permanent brain damage, long-term disability, and even death can result from delayed recognition. Families cannot rely on assumptions or hope that symptoms will resolve on their own. Vigilance, preparation, and immediate medical response are the most effective defences against these silent threats. By understanding the connection between undiagnosed heart failure and nocturnal strokes, and by knowing the 5 sneaky symptoms in detail, families gain the knowledge necessary to act swiftly. Education and awareness transform fear into empowerment, giving caregivers and seniors the tools to protect their health when it matters most. Nocturnal strokes in seniors are often overlooked because they happen quietly and without dramatic warning signs. Raising awareness is a crucial step in preventing these silent tragedies. Families, caregivers and seniors themselves must be educated about the subtle signs that can indicate a stroke at night. Knowledge empowers individuals to act quickly, potentially saving lives. Sharing information with friends, family and community members can increase vigilance and create support networks. Simple actions like discussing the 5 sneaky nocturnal stroke symptoms or checking in with elderly relatives regularly can make a substantial difference. Healthcare professionals can also provide guidance on prevention, monitoring, and lifestyle adjustments tailored to individual risk factors. Engaging seniors in conversations about their health encourages them to take responsibility for their well-being. Asking about nighttime symptoms reviewing medications, and discussing lifestyle changes fosters collaboration between seniors and caregivers. This proactive approach not only helps detect potential problems early, but also reduces fear and uncertainty by creating a sense of control over health outcomes. That's why it's so important to be aware of these silent killers and to recognise the symptoms early, from unexplained night sweats to sudden dizziness, extreme fatigue and swelling in the legs. Each of these signs could be an early warning sign of something much more serious happening inside your body. If you or a loved one is experiencing any of these symptoms, don't brush them off as part of aging. Seek help from a healthcare provider who can assess the situation and offer appropriate treatment. The earlier you catch these conditions, the better the chances of managing them effectively and preventing further damage. Take a moment to share this video with someone you care about. It could be the information they need to save a life. And if you found this video helpful, please don't forget to like, comment and subscribe for more health tips.
Thanks for watching, and as always, stay informed, stay healthy.